A good medication that we now have available for oral sedation is called Dormosedan Gel. It's a form of sedation we use in the vein quite often for dentals and injections, things that we need a reliable level of sedation for. It's now available in this oral form. Note that I am wearing gloves. If you had cuts or got this absorbed through one of our membrane surfaces, it can be very dangerous. So take the proper precautions and wear gloves. How you work this is on the box there's a good labeling. For your average 1,000-pound horse or to 1,100-pound horse, you're going to do, there's little markers on here, 2.5 to 3 mils. So you'll take this little blue knob, mark it to the volume you want, and then turn it. And it will click, and that tells you that it's locked. If you had a mini and you were just using a little bit and you gave them the whole syringe, we'd be in trouble. So this is nice in that it locks. The one thing about Dormosedan Gel that's different than, say, dewormers or oral medications is we actually don't want them to swallow it. So how we do this medication is just take it up and actually aim underneath the tongue, unlike you would do on a normal oral, and then squeeze the plunger all the way. You can get it in the side of the mouth, that does work too. Main thing is we don't want feed or water in there, so make sure their mouth is clean so it gets well absorbed. Then what you do is put them in a stall or a quiet place for about 30 to 45 minutes, and that sedation will start to kick in and get to its true level. If there's exciting things going on or they're already worked up, this will not work as well. One other thing is to note is to put them in a stall without hay or water. A lot of horses are smart and they wash their mouth out, and then you won't get any effect. This drug is really helpful for clipping, things that you do kind of in the barn. It's not a drug for riding. It can help in small doses for trailering as well. Farrier appointments, it tends to work very well. So, and it's safe. We have it at the clinic for pickup, but feel free to ask us questions on dosing. It's a little bit different than oral medications.